Hi, a lot of people complain of puffy eyes, especially people above 30 years of age. They feel that their eyes are looking very puffy, and even after a good night's sleep, they still look very tired. Okay, so in this video, I'll be telling you what are the causes of puffy eyes and how you can reduce it. The most common cause for puffy eyes is aging. As we age, the skin under our eyes becomes thin, and the fat that is present underneath the skin tends to pop out and protrude out. This is why you get this puffiness under the eyes. So the puffiness due to aging starts very slowly, like it starts in about 30 years of age, and first when you notice it is very mild, like when you look up like this, that is when you will be noticing the puffiness under the eyes. But as your age progresses, then you notice that even when you are straight up, that time also the eyes are looking puffy. This puffiness does not usually improve during the day. It tends to look more prominent in the mornings but tends to remain the same throughout the day. Second cause for puffy eyes is water retention. If you have hormonal imbalance or after excessive salt intake, you can notice that there is puffiness under the eyes. So because the skin under the eyes is very thin, any kind of water retention shows very easily on the eyes. If you have irregular menstruation or thyroid dysfunction, or if your blood pressure is not under control, or you've just changed your blood pressure medicines, this can also lead to a sudden appearance of puffiness under the eyes. Even certain allergies can lead to puffiness under the eyes. So if you have chronic sinusitis or atopic dermatitis in which your eyelids get very itchy and you have a habit of constantly rubbing your eyes, this can also lead to puffiness under the eyes. If you're allergic to any type of creams that you're applying on the face, that can lead to contact dermatitis and swelling or puffiness of the lower eyelid. Puffiness under the eyes can also occur if you have a habit of sleeping on your face. So if you sleep on your stomach with your face downwards, this can also lead to puffiness on the face. This type of puffiness is very prominent in the morning. So as soon as you wake up, you feel your face looks puffy, your under eye area looks puffy. But as the day passes, the puffiness tends to improve. So what are the treatment options for puffy eyes? The treatment depends upon the grade of puffiness. So if it is mild puffiness or moderate or severe. Okay, so the treatment varies in these type of grades. So the first is mild puffiness. So if you just have mild puffiness that is prominent when you get up in the morning, then you can just maybe use a cold spoon. So you can place a spoon in the fridge at night in your freezer and then just take it out in the morning, and you can just rub it under your eyes. Okay, this way it'll give a very soothing effect to your under eyes. It'll help in reducing the edema. So application of cold spoons or cold tea bags will help in vasoconstriction. That is, it reduces the size of the blood vessels, so the fluid that comes out is less, and then it helps in drainage. Okay, so that way you'll feel that the puffiness has reduced. So you can use either a cold spoon or frozen tea bags, or you can even slice a potato or a cucumber and place it on your eyes for about 5 to 10 minutes, and this will really help in reducing the puffiness. If you are a busy person and you're on the go, then just rubbing a spoon for about 10 to 15 seconds will also lead to visible improvement in the puffiness. You could also use certain under eye creams that contain caffeine. So caffeine tends to cause vasoconstriction, and that tends to reduce the puffiness under the eyes. So you can apply this under eye cream twice a day, once in the morning and once before you go off to sleep. This way, when you get up in the morning, your eyes will not look very puffy. So what can be done if you have moderate puffiness? That means the puffiness remains throughout the day but is not very prominent. Okay, so in this case, you can go for filler injections under the eyes. So if you inject in the tear trough area, then this will fill in the groove between your eye bags and the cheeks. Okay, so this will make your puffiness appear less. So what are these fillers? These fillers are made of hyaluronic acid. Hyaluronic acid is normally present in our body, but this filler is in a concentrated form of hyaluronic acid. So when it's injected under the skin, it tends to attract water, and then it just lifts the skin. So this way the groove will be filled and the puffiness will look much better. but make sure that you take these filler injections from a trained professional, because an incorrectly placed filler can actually make your puffiness look worse. Fillers can be given once every 12 to 18 months, so the results last anywhere for 1 to 1.5 years. And given by a trained professional, by taking all the precautions, then this is very safe treatment and there are usually no side effects. So after a tear trough filler injection, you might have a little bit of bruising and you might experience a little bit of swelling for 2 to 3 days, but it usually resolves and in about a week it all comes back to normal. So what can be done if you have severe puffiness? This is seen usually in people who are more than 50 years of age. In them they have a very lax skin, so the fat under the skin tends to protrude out and it makes them look very tired and older than they actually are. So in such a case, surgery is the only option. No cream or no treatment can really help you if you have a lot of fat protrusion. Okay, so a lower eyelid blepharoplasty is the best option. In lower eyelid blepharoplasty, they make a very thin incision in the margin of your lower eyelid and then they remove the fat from under the skin and then stitch it up. So there are no visible scar lines or suture lines after the procedure, and that leads to dramatic improvement in your eye bags. So there you go, a short video on puffy eyes. I hope you found this video useful. If you like such skin and hair related content, then you can follow me on my Instagram handle, Dr.Aanchal MD. I post such skin and hair related content daily. Thank you for watching.